Today, I'm answering a question nearly all of my patients ask at some point in their weight loss journey. Do I have to stay on GLP-1 medications forever? If you have wondered this, you are not alone. And the truth is, the answer is not the same for everyone. Hello and welcome back. And if you're new here, I'm Dr. Bazgha Khalid. I am an internal medicine and obesity medicine specialist, and I prescribe GLP-1 medications in my clinical practice for weight loss and weight loss maintenance. And today, let's discuss a topic that causes so much distress and confusion. Do I need GLP-1 medications forever? Or what happens when I stop my GLP-1 medications? Let me know in the comments if you have asked your doctor this question and share your experience so that we can learn together. Now, here's the truth. The answer to this question is not the same for everyone. Some people do great, some struggle. Some need these medications for long term, and that is okay. Today, I'm going to explain exactly why your body responds the way it does, who can safely come off GLP-1 medications, who may need GLP-1 medication support longer, and how to make a plan that actually works for your health goals. Here's what the video will be covering: how GLP-1 and GLP-1 GIP medications actually work in your body, why some people can stop GLP-1 medications and still maintain results, and why others genuinely need long-term or even lifelong medication support, which patient categories tend to struggle most when stopping the GLP-1 medications, clinical studies on weight regain, titration speed, and what happens when you stop GLP-1 medications too quickly. How to know your plan, whether it is short-term, long-term, or maintenance. And finally, the most powerful healthy habits that, when built while taking GLP-1 medications, can help you maintain weight loss even after stopping the medications. You don't want to miss that for sure. This channel shares general information, not personalized medical advice. Please talk to your own clinician for guidance. Let's start by a brief review of how GLP-1 and GLP-1 GIP medications work. GLP-1 medications like Ozempic and Wegovy work by mimicking a natural hormone your body already makes called GLP-1 or glucagon-like peptide 1. GLP-1 hormones helps to slow down your stomach emptying, reduces appetite, improves insulin response, and sends stronger I'm full signal to the brain. While GLP-1 GIP medications like Mounjaro and Zepbound work one step further. They activate two hormones, GLP-1 and GIP, which is short form for glucose-dependent insulinotropic polypeptide. Adding GIP helps improve fat metabolism, increases fullness, improves insulin function, and enhances weight loss. So think of GLP-1 as your fullness and appetite hormone, and GIP as the hormone that helps your body process nutrients more efficiently. For many patients, these medications help correct long-standing metabolic issues, which is why for some people, stopping the medication leads to weight regain. So here's the big question. Do you need to be on GLP-1 medications forever? Now, this is the part most people misunderstand. Remember, excess weight or obesity is a chronic metabolic hormonal medical condition, not a temporary issue. Just like high blood pressure or diabetes, most people need long-term treatment, but not everyone is the same. Some people use GLP-1 medications short-term. Some need long-term and others need maintenance doses. Let's break this down. So, who are the patients who can likely stop the GLP-1 medications? These are people who usually do well coming off the GLP-1 medications once they reach their goal weight, as long as healthy habits stay in place. Number one, patients whose main issue was appetite dysregulation. Not emotional eating, not trauma-driven eating, just biologically overactive hunger signals. Once weight is lost on GLP-1 medications and good habits are in place, they often maintain success. Number two, patients who made strong lifestyle changes. While on GLP-1 medications, they built high protein eating, strength training routines, regular movement, stable sleep habits, and structured eating patterns. The medications help them bridge the gap, but they built the skills to maintain it and do really well coming off the medications as long as they stay consistent with healthy habits. Number three, patients with mild obesity like BMI between 30 to 32, especially those without metabolic diseases like diabetes, high cholesterol, or high blood pressure, mostly can do well after stopping GLP-1 medications while keeping the healthy habits in place. Number four, patients who have a successful maintenance plan. This may include lower doses of GLP-1 medications for maintenance or other medications like metformin for insulin resistance or PCOS, high protein diet, exercise, especially strength training, schedule regular follow-ups. Now, these individuals can often come off GLP-1 medications safely after reaching their goal weight and are able to maintain the weight loss as long as healthy habits stay in place. Remember to always consult your doctor before making any change to your medication dose, and do not stop abruptly without consulting your doctor. So, how about patients who struggle when stopping GLP-1 medications or need long-term GLP-1 medication therapy? Let's talk about people who typically need long-term or lifelong medication support. Number one, patients with early childhood obesity. Their brain pathways for hunger and fullness were programmed differently from a very young age, and they usually require long term medication use for weight loss and then for weight loss maintenance. Number two, patients with multiple weight regain cycles. If someone has lost and regained weight several times, the body becomes more resistant. They usually have significant insulin resistance, leading to very hard to lose weight, and therefore mostly require GLP-1 medications for long term. Number three, patients with metabolic conditions, including insulin resistance, PCOS, type 2 diabetes, fatty liver, usually need GLP-1 medications for the long term. Number four, patients with emotional or binge eating drivers. If the GLP-1 medication is stopped prematurely before psychological patterns are addressed, then weight regain is very common. Number five, patients with high starting BMI or long-term obesity. High starting BMI, usually 35 or more, or long-term obesity means the body has a stubborn set point. Set point is the weight the brain tries to defend, therefore making it harder to lose weight or very high chance of weight regain if GLP-1 medications are stopped prematurely. Number six, patients without a maintenance plan. Stopping without a plan equals rapid weight regain. So, what the clinical studies show? Let's talk about real clinical data. Step trials for Wegovy show people who stopped Wegovy regained 2/3 of the weight within a year. Why? Because the hormone support was removed, but the biological drivers were still there. SURMOUNT trial for Mounjaro and Zepbound show that stopping the medication led to significant weight regain unless a structured maintenance plan was in place. However, those who stayed on the medication during these clinical trials were able to maintain the majority of their weight loss. Also, remember that dose titration speed matters and matters a lot. Research shows that going up on medication dose too fast would lead to more nausea, more dropout, and poor compliance with the medication. Stopping the medication too fast would lead to rapid return of hunger, cravings, and weight regain. However, gentle adjustments lead to better long-term success. I have a video on GLP-1 dose titration that you can find under GLP-1 weight loss guide playlist. The studies all point to one truth. GLP-1 medications work while you take them. If the biology that caused weight gain is still present, stopping the medication brings those signals right back and leads to weight regain. So, how to know your plan? So, how do you know if you are someone who needs GLP-1 medications long term? Ask yourself a few questions. Do I struggle with weight since childhood? Do I have medical condition tied to weight? Do I regain weight easily between diets? Do I have emotional or binge eating triggers? Do I have trouble controlling hunger without medication? If the answer to several of these questions is yes, you may benefit from long term therapy, either full dose or a reduced maintenance dose. And there is nothing wrong with needing continued medical support. Remember, obesity is a chronic condition, and there should be zero shame in treating it long term. So, the bottom line, here's the honest truth. You do not have to be on GLP-1 medications forever, but some people do need long-term support, and that's completely valid and medically appropriate. The goal isn't to stay on the highest dose forever. The goal is to find the sweet spot where you feel healthy, strong, and stable, whether that's with no medication, a maintenance dose, or a full therapeutic dose. This is individualized medicine, not one size fits all, and your doctor can decide the best medical plan for you. Now, here are the most powerful healthy habits that, when built while taking GLP-1 medications, can help you maintain weight loss even after stopping medications. Prioritize high protein daily to protect muscle and metabolism. Do strength training 2 to 3 times a week to maintain muscle mass. Learn smaller, satisfying portion sizes. Choose high quality foods, lean proteins, vegetables, high fiber carbohydrates, and healthy fats. Keep consistent meal timings to avoid overeating cycles. Practice listening to hunger and fullness cues. Break trigger eating patterns like late night snacking, stress, or boredom eating. Build a weekly routine for grocery planning, prepping, movement, sleep, hydration. Recognize early red flags for weight regain and see your doctor to manage quickly. Adopt a maintenance mindset, not an on and off diet mentality. The biggest advantage of GLP-1 medications is that they give people mental space to learn that weight loss isn't a sprint, it's a marathon. Excess weight is a chronic condition. A mindset shift towards weight loss maintenance, not dieting, is one of the strongest predictors for long-term weight loss success. Remember, needing long term treatment doesn't mean you have failed. It means your biology deserves ongoing medical support. And if you can come off medication safely and maintain your weight loss, that is great. However, this needs discipline and consistency. The key is having a plan that works for your body and your healthcare needs. It's best to talk with your doctor, make a plan that supports your health needs. I hope this video gave you some clarity and maybe a little peace. If this video helped, please hit like, subscribe, and let me know in the comments what GLP-1 or weight loss questions you want me to tackle next. Thanks for watching. Stay happy, healthy, and well. Bye for now.